Welcome to the Australian Physio course, the first course completely online to prepare you for the Australian Physiotherapy Council's clinical assessments. This is the last step before you get your final certificate, and then you're allowed to apply for the general registration with APRA, which will allow you to work anywhere and with no restrictions in Australia, and finally be free from any paperwork. The process is tough, but it's all worth it. I cannot explain how good it feels when it's all over. The power of being able to do anything you want with your career. Ask any other candidate who's gone through this and they'll say the same. Once you pass your written assessment, you'll have a few months to wait and prepare for your clinical assessments. There's 3: cardiorespiratory, neurological, and musculoskeletal. The clinical assessment will happen in just over 1 hour. You'll enter the simulation lab and you'll be seated in the reading room. A few minutes later, you'll be given the file where you'll find some information about your patient. 10 minutes later, you'll meet your examiners and give your presentation for a maximum of 5 minutes. Then you'll meet your patient and we'll have 50 minutes to complete the subjective and the objective assessment and the treatment. If that's your first attempt at them, you'll perform all 3 clinical assessments on the same day, one after the other. Before we go on the details of this course, I want you to get to know me and the reasons why I'm here talking to you. My name is Carmelo, and just like you, I'm a physiotherapist trained overseas. I got my bachelor degree in Milano, in Italy. During my career, I worked mainly in musculoskeletal settings, usually outpatients. I came to Australia, started the APC process, started working under limited registration, prepared for a few months and passed the written assessment at the first try. That's when the problems started. I prepared for a few months for the clinical assessments, passed the cardio and neuro component with 95 and 100% scores, but I failed the musculoskeletal exam with a 10% score. I was outraged and shocked. How could I fail so miserably? Why was there such a big difference between the scores if I prepared in the same way? Am I a terrible physiotherapist? I thought that might have been a mistake, so I applied for an internal review, but it wasn't granted. Oh well, I thought, I just need to focus on one section now, everything will be fine. I failed again with a 7% score. It was one of the worst days of my life. I didn't sleep the night and cried and yelled and just had no words. No desire to wake up in the morning and show everybody what a failure I was. I was so embarrassed, ashamed, angry. What do you do then? Give up your career, start the whole process again. I felt I was damned to a life of studying and struggle. Luckily, I was given one last chance due to a bureaucratic mistake, but I'm still scarred by those days when I thought everything was over. I had a long time to prepare again, and this time I had to change my approach entirely because it led me to fail twice already. What I was doing was wrong, and it had to be abandoned. I started collecting information from past and present candidates, textbooks, colleagues, and the council itself. This course is the result of thousands of hours of research and experience, not just mine, but of all the people I've met, talked, and experimented with. In this course, you'll learn everything you need to know about every section of the exam, but most of all, you'll learn a framework that is proven to work to make you pass the exam. You can use my framework as it is, or personalize it to best suit yourself. The framework is based on the domains and performance indicators given by the Australian Physiotherapy Council itself. You learn to know the meaning of the items one by one, focus on the most important ones, and address them appropriately. After that, you learn how to create a cheat sheet that will guide your exam step by step, making you feel confident. With the cheat sheet all lined up, I'll guide you through the smoothest and most effective subjective and objective assessments. You'll be prepared to address all the different scenarios, leaving nothing to chance. Once you've mastered the cheat sheet, the interview, and the objective assessment, you'll understand how the treatment part is actually the easiest. I'll teach you how to create a simple and effective treatment plan and to implement it quickly. Just a few notes before we start. This course will give you all the tools to pass the exam with no difficulties. However, you'll have to practice a lot. You need to make it yours and be a champion in performing the exercises that I'll give you. If you feel you're not confident or proficient or quick enough, it means you still need to train. I will give you precise instructions and indicators to assess your preparation and decide whether you're ready or not for your exam. During this course, we'll be focusing mainly on the musculoskeletal scenarios. Most of my examples will be about musculoskeletal presentations, both general and post-operative. It'll be easier for you to learn the framework in the section you'll need it the most, and you won't have to jump back and forth between one topic and the others. The musculoskeletal part is the hardest for different reasons. There's more scenarios, there's more than 20 different cases, there's more protocols. You need to remember injuries and post-operative protocols and common presentations in Australia. There's more failures. This is the exam people fail the most. By far, if you're ready for this one, you're ready for everything else. However, I'm not abandoning you for your cardiorespiratory and neurological components. The framework is just the same. You'll have access to bonus content that will give you clear instructions about how to integrate the framework for the neuro and cardio needs. I told you earlier I was going to tell you who I am and the reasons why I've created this course. I've created this course so that you don't have to experience what I went through, what too many other candidates are going through. Nobody deserves to experience that pain. I've created this course because there's no guidance, no support. All candidates are by themselves, struggling to collect reliable information, wasting countless hours on social media and messaging apps to try to get advice, and double guessing then that advice. The volume of work to do, of protocols and procedures to remember, is huge, and it seems completely arbitrary. After a while, everything seems fundamental and irrelevant at the same time. There's lots of courses and mentors out there to help you, but how many courses can you attend? And why candidates who've attended the courses still fail? You just feel frustrated and helpless. Well, this course is everything you need to pass the exam. Following the framework will give you confidence and give you the best chance to pass the exam with any level of preparation. Plus, I'm a real person that you can reach for support, mentoring, and feedback. I won't disappear, and I give you my word you'll succeed. That's why this course has a money-back guarantee. I'll be here with you until the end, until the day you'll be proud to say, I am an Australian physio.